Okay, so you sent over some stuff about Alzheimer's.
Yeah.
Some resources and things, including some stuff from the Cleveland Clinic.
Mm-hmm.
So I think this would be a great topic for a deep dive today.
For sure.
I think this is something that, you know, hits close to home for a lot of people.
Yeah.
Whether they're facing it themselves or know somebody that is, or just, want to be informed.
Right.
It's such a prevalent, disease.
Absolutely.
And so I think it's great you're taking the time to learn more about it.
Thanks for having me.
So before we get into all the nitty gritty details,
Okay.
let's just start with what ISIS Alzheimer's disease.
Yeah, that's a great question, and I think a good place to start.
Yeah.
Because a lot of people might just think it's part of aging, right?
Exactly. Yeah. Is it just a normal part of getting older?
Yeah, and that's a common misconception.
Okay,
It's
yeah.
not just typical aging.
Mm-hmm.
Alzheimer's is actually a progressive brain disease,
Okay.
which means that it gets worse over time. And it's actually the most common cause of dementia,
Really?
affecting millions of people worldwide.
Millions.
Yeah,
Wow, that's a huge number.
it is.
Okay, so we're not just talking about a few senior moments here and there.
No.
This is a serious condition.
Right.
So how does this disease actually affect the brain?
So imagine your brain
Okay.
as a vast network of billions of neurons,
Right.
all constantly sending messages back and forth.
Mm-hmm.
That's how we think, that's how we learn, that's how we remember.
Yeah.
But with Alzheimer's,
Hmm.
things get disrupted.
Right.
There are two main culprits that are often talked about.
Okay.
One are amyloid plaques,
Okay.
and the other are tau tangles.
Okay, so what are those?
So think of amyloid plaques as like these sticky clumps
Uh-huh.
that build up between the brain cells,
Okay.
kind of like gum clogging up a pipe.
Oh, okay.
This buildup prevents messages from flowing smoothly between those neurons.
So that's one problem.
That's one problem.
What about these tau tangles? Are those also gum in the pipes?
Not exactly.
Well-
Tau tangles are different.
Okay.
They're actually like twisted wires
Okay.
inside the neurons themselves,
Wow.
making it hard for the cells to function properly.
So instead of blocking the communication between cells, they're blocking the communication within the cell.
Yeah, it's like trying to send a message through a phone line that's full of static and crossed wires.
I got it.
Yeah.
So plaques block the messages between cells, and tangles mess up the messaging within the cells.
Okay.
Like a double whammy for the brain.
Exactly.
So with all this going on in the brain,
Right.
what are some of the signs
Yeah.
that somebody might be developing Alzheimer's?
Yeah, I think you're right to focus on the early signs.
Yeah.
They can be subtle,
Right.
but there are some key red flags that the Cleveland Clinic highlights.
Okay.
One of the biggest ones is increasing memory problems,
Okay.
especially forgetting recently learned information.
Yeah, like what you had for breakfast this morning.
Yeah, exactly. Or like someone's name that you just met.
Right, right.
There's also difficulty completing familiar tasks.
Okay.
So things that you used to do all the time,
Mm-hmm.
like following a recipe
Yeah.
or balancing a checkbook.
Right.
Things like that maybe you've done your whole life
Mm-hmm.
that are now becoming more difficult.
Got it.
Confusion about time or place is another warning sign.
So getting lost on the way home, even though you've lived there for 20 years?
Exactly. Or forgetting what day it is.
Right, right.
And it's not just cognitive changes.
Oh, okay.
Personality changes can also occur,
Oh, wow.
like becoming more withdrawn
Mhm.
or irritable, suspicious.
Okay.
Poor judgment is another concern.
Like what kind of poor judgment?
So like giving away large sums of money
Oh, wow.
or neglecting personal hygiene.
Okay, so those are all things that,
Yeah,
it's kind of scary because it's so easy to miss those things.
absolutely.
Or to just dismiss them as, they're getting a little older.
Okay.
So it sounds like awareness is key here.
Awareness is key.
Okay, so we've talked about what Alzheimer's does to the brain,
Right.
but what actually causes it?
Yeah.
Is it just bad luck?
Right.
Or are there certain things that increase your risk?
I think that is the million-dollar question.
Yeah,
And the truth is that we don't have a single definitive answer yet.
right.
But research suggests that it's likely a complex interplay of factors,
Okay.
including age, genetics, lifestyle choices, and even environmental influences.
Okay, so break that down for me.
Sure, so age is the biggest risk factor, unfortunately.
Okay.
Most people who are diagnosed with Alzheimer's are 65 or older.
Okay, so that's something we can't control, right?
Unfortunately, that's not something we can control.
Okay, what about the other things you mentioned, like lifestyle and environment?
So while we can't control our genes
Mhm.
or completely eliminate the risk,
Mm,
research suggests that a healthy lifestyle
Yeah.
can play a significant role.
So there are things that people can do
Yeah, absolutely.
that might be able to
Yeah,
reduce their risk.
exactly.
Okay, like that.
So regular exercise,
Okay.
a Mediterranean diet that's rich in antioxidants,
Hmm.
and staying mentally active
Oh, okay.
through things like puzzles, reading, and social
Oh,
interaction
that's interesting.
might all contribute to brain health
Got it.
and potentially lower the risk.
That's actually really encouraging.
Yeah.
So it's not all like doom and gloom.
No, not at all.
Even though there's no cure yet, it's not completely hopeless?
No, I wouldn't say it's completely hopeless.
Right.
While there is no cure currently,
Hmm.
there are medications that can help manage symptoms, at least temporarily,
Hmm.
and ongoing care is vital.
So it's not just about medication.
Right.
It's about creating a supportive environment
Exactly.
that helps the person, you know, maintain their independence and
Yeah.
quality of life
Right.
for as long as possible.
For as long as possible.
Yeah. And you mentioned in the material that you sent over
Mm-hmm.
that you're actually concerned about this for your family.
Yes.
You know, you're right to think about these things.
Absolutely.
I think it's a heavy topic.
Yeah, it's a heavy topic.
Kind of wrap your head around.
It is.
But it's important to acknowledge that this disease,
Right.
it takes a toll not just on the individual,
Right.
but on their loved ones as well.
Exactly. Yeah.
The emotional, the physical,
Mm-hmm.
and the financial burden can be significant. So for people who are dealing with this,
Right.
where can they turn for support?
So there are some incredible resources out there.
Okay.
One of them being organizations like the Alzheimer's Association.
Okay.
They offer a wealth of information, support groups, and even financial guidance for both patients and caregivers.
So it's good to know that you're not alone
Yeah,
if you're dealing with this.
absolutely.
I think this has been a really insightful deep dive,
Yeah, I agree.
even though it's, a tough subject.
It's a tough sub.
So I appreciate your expertise and honesty.
I appreciate you having me.
Absolutely. And I think for you listening,
Yeah.
remember, this was just a starting point
Right.
based on what you wanted to kind of explore.
Mm-hmm.
We encourage you to keep learning, maybe even by visiting the Alzheimer's Association website.
Yeah, that's a great idea.
And here's something to ponder as you continue your journey.
Okay.
We covered a lot about what Alzheimer's does.
Right.
But what about how it changes our very concept of self and identity?
Yeah,
That's a really complex question
it is.
with no easy answers.
Absolutely.
So, till next time.
See you then.